why, again, are we still only spending 5% of all healthcare expenditures on primary care when we know, primary care is the key to any system of healthcare, and yet and we're far below other developed nations in that regard, and it's probably one of the reasons why we're seeing longevity in this country decline. We're the only advanced nation, the only one in which lifespan is decreasing, which is absolutely ridiculous. Another question is, we all talk about evidence-based medicine, but we know that the evidence is that most of health outcomes have nothing to do with clinical care. They have everything to do with the social determinants of health. And so why aren't we spending, again, more resources on the social determinants of health? So I just think those are, I think if we don't do what you're saying, if we don't ask those really fundamental questions, and to what the speaker was saying before, we want some answers. This isn't just about raising the questions. The questions are there to incite some thoughtful response and some, I would say, action with integrity. So I do think what you're doing here by asking these really fundamental questions and sort of, again, we're at a, 30,000 feet level, but sometimes, what? You need to actually have that. You need to be above the crowd. You need to be looking down and really asking some fundamental questions and issues and challenging the system in that way.
Go ahead, Todd.
And if I could just add on to that, I think that's brilliant, Zev. And I would take it one step further, that we need to not only ask the questions, but when we find positive examples and or solutions, we need to celebrate and highlight and prop those individuals up, shout loudly what they're doing, and hopefully we can create, to coin a phrase, ripples and waves of change, if you will.